Okay, I think we can get started. Welcome everyone to room 3, the consulting services room. My name is Tino. I'm from the DS Africa Coordinating Center. So we will have two presentations in this room. The first presentation will be from Insight Health Consulting, and Tochukwu will be presenting on their behalf. You can go ahead and start, Tochukwu. And if you have any questions, please put them in the chat, and also feel free to introduce yourself in the chat as well. Thank you, Tochukwu.
Thank you very much, Tino. Good day, everybody. Tino, can you let me share my screen? Okay.
You should be able to. Okay, yeah, there we go.
All right, thank you very much, everybody. My name is Tochukwu Osuji. I'm the programs lead at Insight Health Consulting. I'm here to talk briefly about Insight Health Consulting, what we do, and our interests. We are a public health consulting firm registered in Nigeria in 2004. So we have about 2 decades experience working in the public health and development sector. We typically work with international and local development partners, government and non-governmental organizations, health programs, funders, and even academic institutions. Our vision is to be an outstanding and dependable health consulting firm with the mission to catalyze positive and sustainable health outcomes in Africa through our technical support. We are ISO 9001 certified, an institutional member of ISQA, an accredited provider of continuing professional development by MDCN, and a licensee of self-care standards and digital platforms, specifically for healthcare quality improvement in Nigeria. Our core services are categorized into 4: health system strengthening, healthcare quality management, research, and general project management. Under health system strengthening, we provide technical support to improve efficiency and effective decision-making and accountability for leadership through strategic and operational planning. We design and implement health financing mechanisms, including health insurance and social health protections. We also provide technical support to public health insurance agencies to build their institutional capacity to fully operate. We support programs and initiatives to expand access to comprehensive healthcare services. Then through market sizing and analysis, we provide technical assistance for the availability of essential commodities, including designing and implementing drug revolving funds. We design and implement strategies to ensure trained and competent healthcare workers are available at the primary healthcare levels. Our goal under health system strengthening is to support the provision of healthcare systems that are responsive and resilient. For healthcare quality management, we collaborate with relevant stakeholders to design and establish quality management systems. We examine existing systems, processes, and landscape, and then provide technical support to meet the healthcare quality needs. We provide quality improvement support through assessment of health facilities and developing and implementing quality improvement plans to address quality gaps. We conduct capacity assessments to ascertain the current practices, procedures, and performances, and then implement capacity building plans to have a competent health workforce at the facilities to implement and to provide quality healthcare service. Our overall goal is to improve the patient clinical outcomes and satisfaction. We employ methodologies that are patient-centric and use data analytics to drive quality improvement and patient satisfaction. Of course, in our healthcare quality improvement and management spectrum of service, our end product is to improve the quality of service delivery as well as improve patient satisfaction levels. Under research, which is our bread and butter at Insight Health Consulting, we conduct formative research studies to gather information about a target population to inform the planning, designing, and implementation of a project or intervention or even an initiative. We conduct program monitoring and evaluation to systematically measure, analyze, and interpret data to determine a program or intervention's effectiveness, quality, and performance. We conduct implementation research, focusing typically on understanding and improving the processes and strategies involved in the adoption, integration, and scale-up of evidence-based interventions and practices in the real world, with the goal to bridge the gap between research findings and the routine practices in the various contexts. Here I've highlighted some of our clients that we've worked with in the time past. This includes Shell Petroleum Company, Plan International, Pharmacist Foundation, Dalberg, and a host of other clients that we worked with both internationally and locally. In terms of coverage, we have a national coverage in Nigeria and are expanding to other African regions through our work experience and partnerships. We have either worked or have partnered in Benin Republic, Ethiopia, Sierra Leone, Rwanda, Togo, Senegal, and Ghana. And we're still looking forward to other partnerships to drive us to other African regions. Our team, we have a team of experienced professionals led by the board of directors and advisory committee. We have a core staff strength of 13. And of course, because we're a consulting firm, we typically have a close core staff team that provide all the technical support. And of course, we have a pool of consultants that we deploy into the different projects that we implement. Without any doubt, we can be a very reliable resource, local resources, a local resource typically to research partners. We can represent research partners internationally here in Nigeria. We can be your face, your hands, your legs in Nigeria, doing all the logistics, doing all the actual implementation, stakeholder engagement, and all the on the ground delivery of the project or activities. We have a community professional team, like I said before, that has a technical expertise. We have access to dynamic target population for any type of research or intervention or even evidence generation. And we have a national coverage. That is, we can cover any region in Nigeria, leveraging our experience and relationship with the various stakeholder groups. And in terms of what we want to gain, we want access to more funding opportunities, especially on implementation research. We want to have access to expanded networks of professionals, skills and expertise, and other expansion opportunities to other regions in Africa, and of course in the entire globe eventually. So where we have physical offices in Lagos, Nigeria, and Abuja. We have two offices. The Lagos office takes care of all the southern region. The Abuja office coordinates the northern region of the country. Thank you very much. And that will be the end of my presentation.
Thank you so much, Tochukwu, for that beautiful presentation. So we will move on to the next presentation and then take all questions for both after, but you are more than welcome to put your questions in the chat in the meantime. So next up, we will have Herin Ondolo from the Regional Center for Mapping of Resources for Development. Herin, over to you. Irene, you can go ahead. Irene, are you there? Can you hear us? Let me just try to get hold of Irene. Whilst we wait for Irene, maybe we can take questions for Tuchuku. So anyone who has any questions, feel free to unmute and ask any questions you might have. Any questions from anyone? Maybe I can ask Tuchuku. What's the best way for potential collaborators to get in touch with you? And maybe you can, if you're okay, you can share your email in the chat.
Okay, thank you.
Thanks for sharing, Tuchuku. So it seems like we may have lost Irene. So I think we can end this room here, or you can feel free to go and join any other room. There should still be other presentations going on in any of the other rooms. Thanks, everyone.
All right, thank you, Tino.
Hi, everyone. Irene, are you there?
Yes, I'm here. Actually, I'm really sorry for that. I was,
Okay, no worries.
yeah, and my colleague is in and is supposed to present. That's Kenneth Kasera.
Okay, no problem.
Yeah, sure.
You can go ahead, Kenneth. Thanks. Kenneth, are you there? See you joining on a different device. Kenneth, can you hear us?
Yes, I can hear you. Can you hear me now?
Yes, yes. You can go ahead and
sorry.
present. Thank you.
Yeah, sorry. I'll just be speaking about regional center for mapping of resourceful development that is based in Nairobi, Kenya, an intergovernmental institution that provides insight on Earth observation information in agriculture, in water, in land, and also aspects of
Before you
weather
continue,
and climate.
do you have slides that you'd like to share?
No slides. No slides.
Okay, no problem. Go ahead.
Yeah. Okay, thank you. So my name is Kenneth Kasera. I serve as the Youth Engagement Manager at the Regional Center for Resourceful Development based in Nairobi. And it's a pleasure for me to be part of this team today to discuss some of the consulting aspects in data, science, and health. And possibly in line with SDG 3 on well-being and also on the clean water aspects in SDG 6 as well. So the center supports and provides insights in using Earth observation data, remote sensing, GIS in aspect of water, aspect of agriculture, aspect of land, and aspect of health as well. And so in that regard, we are quite aware of the population that we are providing service to, which is critical. Because if you look at Africa as a continent, as we speak today, we are possibly 1.4 billion and plus, and this comes with challenges in terms of that various user categories and with the push of trying to improve the quality of life for all, and also aspect of mapping for sustainable development, and all this pulls along with its aspect of health, aspect of well-being, deprivation, poverty, and equality as well. And so the center is focused on aspect of policy at that higher level, where we take part and parcel in policy formulation that relates to health, and also in terms of capacity development, aspect of using Earth observation data to be able to influence as simple as access of health centers. So we've done suitability mapping in various institutions and in various cities so far in terms of looking at the accessibility in health, and that also pulls easily and closely with the transport modeling systems within our cities, in line with improving the quality of life in them as well. So we, as another aspect of capacity building that we are supporting as well, entails aspect of supporting capacity in air quality, which is critical in major cities, as we continue to look at the balance between environment and development, and that comes along with the destructions of the ecosystems that we believe should be able to support the quality of life in the urban setups. We find ourselves in situations where the air quality bit is affected in most of the towns. And that leads to possible reduction of lifestyle and lifespan of individuals, and also introduction of chronic diseases that possibly can be avoided if we consider Earth our home, and if we use the various technologies that we have on board so far. And aspect of water quality as well. So we handle aspect of air quality and water quality in major lakes, looking at the physical aspect of the cleanness in the water, and possibly looking at the surrounding as well, because agriculture and various activities that happen around the various lakes, they add up to some of the pollutants that get into these water bodies. And so that's critical aspect of observation that we get from satellite, and also fusing with the in situ data. We're able to make decisions on possibly the sources of some of these pollutants that get into our lakes and in our water. That's and these are systems that supplies water to the various towns and the residents of the towns as well. And so we focus on partnership as well, because some of these aspects cannot stand alone. And also with the mandated institutions, Ministry of Health, Ministry of Agriculture, Ministry of Environment in various states, to be able to support them in terms of looking at the holistic aspect of how this affects the population. So we also support in data. So apart from all the capacity building aspects, we support in acquisition of data, processing as well as generating information from that various data set. So aspect of data of data analyst is something that we are critical and keen to also look at in terms of the staffing level at the center. So we support in aspect of data analysis, data storage, fusion and integration with the data that already exist. Yeah, so in brief, that is what the center supports: aspect of capacity development, aspects of data information, data and sharing, and possibly looking at and then integration of the system that already exists in that regard. So data science and health, a critical part of this institution. And so far I've mentioned that we support 20 countries in eastern and southern part of Africa in provision of insights of information that is meant to support agriculture, support water, support weather, and support geohealth through WHO, because we work closely with them as well, and aspect of land. So allow me to end there and over to you. Thank you.
Thank you so much, Kenneth, for that presentation. We will now take questions. You can feel free to unmute yourself and ask your question, or ask your question in the chat. I see we still have Tochukwu on as well, so you can ask to either of our presenters. People are thinking, maybe Kenneth, you can also let us know what's the best way to contact you if we would like to collaborate with you.
Okay, so you can reach us through email or possibly WhatsApp or phone calls. My email address is kcasera@rcmrd.org. But I'll type it in the chat box if that is acceptable. So possibly
Yes, please do.
WhatsApp number as well. So let me just use the chat box to chat and write it there.
Thanks, Kenneth. Questions from anyone in the room? Okay, seems like there are no questions, which means the presentations were clear and answered everyone's questions. So thank you once again to Kenneth and Tochukwu for their presentations in the room at this stage, and you are free to go enjoy one of the other rooms. Thanks, everyone.